Welcome, everyone, to our second session on day 2 of this amazing conference. This one is entitled Coping with Side Effects. And you can imagine how large a topic this is. And we're going to attempt to accomplish a great deal in the next 40 minutes. I think the most important thing to understand about this session is that we're going to explore both the physical as well as the psychological side effects that oftentimes exist in cancer treatments, what you can expect, what's normal, what's not normal, the kinds of professionals you can reach out into the community. We're going to do a deep dive into all of that. And with me, we have a really extensive, wonderful panel. I'm going to welcome back Carine Legault, who you met earlier yesterday. Carine is Colorectal Cancer Canada's Manager of Patient Support. Is going to be my right-hand man on this session. I'd also like to welcome first Jesse Whyte, who is a highly experienced coach and certified athletic therapist who has spent over 15 years helping his patients achieve their health and fitness goals. I really love that we're bringing somebody like Jesse to the table here. With a focus on breast and thyroid cancer conditioning and rehabilitation, Jesse brings a unique combination of high-performance therapy and cancer expertise to his work. Throughout his career, he has achieved numerous accomplishments, including serving as head therapist at the National Circus School and keeping artists healthy for Cirque du Soleil's Amaluna, I think is how you pronounce the name of that show. They're always very unusual. Having worked in pharmacy settings since her mid-teens, we also welcome Maria Marchese, who has practiced for over 8 years as a clinical pharmacist. She obtained her PharmD from the University of Toronto in 2015 and has completed a general hospital residency at Kingston General in 2016. She has experience in a variety of different settings, including surgery, long-term care, and acute malignant hematology before dedicating her practice to outpatient oncology beginning in 2019. We welcome 2 patients to our panel today. First is Sheilah Brukewich, who lives in the small town of St. Lambert, is how I believe I say that, on the south shore of Montreal with her husband and 2 rescue dogs. Over the last 15 years, Sheilah has worked in a variety of different fields, primarily in accounting and operations. She does love to sing and currently does a voiceover work on the side. Sheilah was diagnosed with colon cancer recently in May 2022, and it is currently in remission. She has shared with our team here that while the experience doesn't define her, has absolutely changed her. And her goal is to share her experiences in a way that can help others, which is why she's agreed to participate with us. And we're very honored to have her. Lastly, I'd like you to meet Robin deKlein-Stimpson, who was diagnosed with stage 3 colon cancer at the age of 51 in April of 2021. And even though she is currently showing no evidence of disease post, she is living with the physical, emotional, and spiritual fallout of continued side effects. Robin has also experienced a 3-year delay in the diagnosis, despite many ER visits, with demonstrated symptoms of colon cancer due to anxiety disorder bias and the COVID-19 pandemic, which of course had a tremendous impact on many aspects of cancer care. Well, Robin always strives to be future positive. Her experiences of not feeling heard and slipping through the cracks continued throughout her treatment. She has practiced cognitive behavior therapy, which we're going to talk about a little bit, which has been helpful, but Robin finds it difficult to use the balance of her tools acquired in her life with some of the anger, anxiety, grief, and fear that have accompanied her diagnosis. Robin, in my previous conversation with us, has been incredibly honest in sharing a very emotional and important story. Robin, too, is honored to be participating today, and we are very honored to have her with us. So thank you, everyone, again for participating. And I'm going to first start with you, Robin, and if you could help our community understand a little bit more about you and your cancer journey, that would be tremendous. Thank you.
Sure. I think you captured a lot of it with the bio, and thank you very much for presenting that. I always neglect to say that I also had a major surgery after I was diagnosed in April 2021. In June, I had sigmoidectomy, and I consider that a major surgery. But I bounced back so quickly from that. That I even forget to mention it sometimes, because I didn't truly feel like a sick person until I started the chemotherapy. And I did the adjuvant therapy where I had the IV oxaliplatin. I'm not sure if I'm saying that right. And the chemotherapy pills, capecitabine. Had quite an experience over 4 months from July to October of 2021. And it really took me quite a while. And I think probably it didn't take me as long as maybe some others to feel human again. So I would say probably August 2022 is when I started to really feel myself. I don't think I'll ever feel myself, but just kind of moving forward and feeling quite well, very active. I'm participating in a physical exercise study, which is great. But what I have at the moment is I cannot reconcile how I'm feeling with what the CT scans are still showing. So even though I am showing no evidence of disease, I have officially just this past week been diagnosed with portal hypertension and esophageal varices. And I've been put on beta blockers, which I didn't want to start because I didn't want to be dizzy or lightheaded for this session, but I will probably start those tomorrow. So it's that sense of, I don't think, even though my treatment is finished and hopefully I won't ever have to go through that again, touching wood, and starting to feel well, it's that sense that this will never really be behind me. And I think I need to come to terms with that, and in fact, come to terms with my diagnosis, and that this will always be a part of my life, and try to do something good and positive with that, while still dealing with the effects of the chemotherapy that I chose to have, even though I had a choice not to do chemotherapy. But the way it was presented to me was, I really felt like that was my only choice, was to take the treatment. So that we could avoid, hopefully, recurrence in the future. So I've got some long-term effects to deal with, and hopefully we don't have any major health complications from that. So just a little bit of fear and anger, and definitely some PTSD and grief that goes with it.
Yeah. And Robin, again, I thank you for being so open about what is oftentimes not talked about as part of a side effect conversation, the psychological or emotional issues attached with that. And so I'm sure our audience would like to know more about it. Sheilah, I'm going to bridge over to you and ask you, please, to share also a little bit about your journey and some of the side effects that you're experiencing or continue to experience.
My experience is quite similar to Robin's. I was diagnosed May 31st, 2022 during a colonoscopy. It's weird when I start relating the story to people because it's like an out-of-body experience. You know, I just go through it piece by piece as if it really didn't happen to me, because you're laying on a table, you're told you have cancer, we're going to refer you to a surgeon, and you walk out the door and you try to absorb that huge news, that information that's devastating. I was referred to a surgeon. I had surgery on July the 8th. Half of my colon was removed. It ended up being an 8-hour surgery, so it was quite intense. I was told after surgery that I was cancer-free by my surgeon. Unfortunately, pathology 2 weeks later decided that we were going to go a different route, and unfortunately, the cancer was in my lymph nodes, so I was stage 3, and my file was then referred to oncology. This is all at the Jewish General Hospital in Montreal, where I actually feel very blessed to be treated. primo service at the hospital, and every team is absolutely amazing, including my oncologist. He suggested the same protocol that Robin had, the infusion of oxyplatin and capsaicin pills. I actually had watched my mother suffer through chemotherapy when she was 59 and was not a fan of it, although it was 22 years ago. And initially, I refused chemo. I actually told my oncologist that I would like to have a second opinion, which I'm very blessed again that he said, of course you do. And I went to Dana-Farber in Boston, where I was told that they not only agreed with the protocol that was being suggested at the Jewish, but they felt it was imperative. So like Robin, I felt like it really was my only choice. It's a tough decision to make because you'll have a lot of regrets if you don't do it and there's a recurrence. You're going to blame yourself that you didn't. You need a crystal ball. So with the information you have, the limited information, and not being a doctor or a chemist or a scientist, you decide to move forward with it. So September 26th, I started pre-chemo meds for anti-nausea. And September 29th last year, I started chemo. I had a reaction from the infusion day one. Usually the infusion's on in 2 hours. They had to start infusing Benadryl, and my infusion had to be slowed down from 2 to 4 hours. Muscle cramping, palsy in my face, my hands, my legs, not being able to stand, the cold sensitivity, not only in your body, but as far as consuming any kind of liquids. I wasn't prepared for how intense that was. I think that those are things that need to be communicated to patients better. You literally can only drink hot water. Then the next day I would start my pills for 2 weeks. And I also had to inject myself with neutrophils for 7 days after in my abdomen as well. So that was my cycle. 1 day infusion, 14 days pills, and 7 days of neutrophils. Long-term side effects, you name it. Fatigue, bone and joint aches, muscle aches. I have neuropathy in my feet and in my hands, hair loss. My skin has been permanently burned. I now actually have precancerous cells in my nose, metallic taste, diarrhea and constipation, bloating, all things too that nobody can definitively explain to you why they're happening or what you should do about them. Um, and yeah, so here I am, maybe 6 months post chemo, and still wondering when those symptoms will start to lessen. That's where I am today.
Thank you very much for sharing all of that. You know, Maria, I'm going to bring you into this conversation because doing what you do and also being a medical professional is how much of both Robin's story and Sheilah's stories are what you hear every day. How common is this? Is there a conversation around what is normal and what is not?
Thank you. And first of all, thank you for having me included in this panel. I love every day of my job. And for me to then do this with you, it's really meaningful. So thank you for sharing your stories, Robin and Sheilah. So I hear stories from my patients as well. And I have to say that each one is a little bit different. And so it really speaks to the fact that each patient's journey on chemotherapy is is a little bit different. Now there are some things that are shared and some features that are shared between them, and that's really what we try to do as pharmacists is to prepare you for what side effects you need to look out for, and also how do we manage those and who do you go to, how do you reach out so that we can help you through that. So I can speak a little bit about some of the more common side effects of the treatments for colorectal cancer. As Sheilah and Robin mentioned, one of the backbone drugs that we use is a fluorouracil, often in the form of capecitabine pills, and oftentimes that's infused with oxaliplatin, which is intravenous chemotherapy. So the most common side effects that we typically see with this regimen is we can see diarrhea, we can see nausea, vomiting, hand and foot syndrome, and I can go into detail on these later on as well. Cold sensitivity with the oxaliplatin, which is what Sheilah experienced, and also neuropathy, so that's numbness and tingling, usually in the extremities. Now, some people will experience the cold sensitivity with oxaliplatin, and there's like a whole, and it can be quite terrifying when it first happens is what I've been sort of shared with. And not everyone, what's so crazy about is not everyone will experience that with an oxaliplatin infusion. So we do have to, we don't want to scare our patients at the very beginning and say, like, this is what's going to happen to you. But we need to, prepare them that, this can happen. It's not dangerous, but it can be quite scary when it happens. And there are certain ways that we can prevent it and manage it. So, for example, um, not being exposed to very cold environments, keeping warm and bundling up, only drinking warm fluids, which for some people can be, an issue. Touching metal surfaces, that has to be avoided. Wearing gloves, anything that will, um, when you're touching something cold or exposed to something cold, cold air coming in through your lungs, swallowing something can be, it could feel like ice pellets, is what I've been told. And it's not a very pleasant experience, but we have to, create a list of things that we can try and adhere to that can become part of your plan in terms of preventing it. And when it comes to side effect management, what I do want to say is that the goal is for you to tolerate your treatments. So if any side effect is interfering with what you do on a daily basis, your quality of life, then that needs to be very early on. We need to start monitoring that side effect and um, then working with you to ensure that your quality of life is being maintained and that that symptom or side effect is not interfering with your daily activities. So really that should be the goal. And your pharmacist, your nurse, your oncologist, the whole cancer care team is there to help um, ensure that you're taken care of, looked after.
Hmm. Thank you, Maria. Maybe I could just ask you, because Robin so openly shared some of the more psychological side of things. As a pharmacist, do people come to you with that, with concerns or side effect issues in that area, or is that a place you would refer to someone else on the team?
Yeah, so although there are some medications that can treat, anxiety or depression, usually we like to include like psychosocial supports early on rather than just to jumping to medication. So generally, when I have a patient, I notice that there's a lot of burden and a lot of change in their perspective or mood, and they're having a difficulty coping with side effects or with their diagnosis. It's important to involve someone, either being a part of a support group, or we have actually dedicated social workers and dedicated psychologists to oncology that you can access at least through our center at Odette. And I generally make a referral with the consent of the patient if they're agreeable to open that door, because it's just another thing that can help you through the journey.
Thank you for saying that. And I think this is a great bridge into Carine and her role, uh, both as a nurse, but also as our lead patient support at colorectal cancer. Carine, you're in touch with, you're aware of not just the physiological impacts, but you're aware of all the community resources. Maybe you could paint a picture for us of what's available, where people should go, what's accessible.
So it's very interesting because there's multiple things that are available for patients, and this is where CCC really comes in, and where it's important for individuals when they're experiencing side effects, both physical or psychological, to sort of reach out to us, because we'll help them guide to the different resources they have available, such as individuals such as Maria within the hospital, or individuals that are outside of the hospital, such as Jessie, as well as we'll be able to talk on the more psychological aspect, sort of our support groups that we have available and different resources that we have available within our organization to sort of help mitigate some of these side effects. Additionally, sometimes we'll propose things that are not necessarily things that individuals will think about. So, for example, I like to sometimes open the conversation with individuals that have a diagnosis that's a little bit more life limiting. where we sort of talk about the involvement possibly of supportive care or palliative care, and sort of open a discussion that it's not only something that we would address at end of life, but can be involved in management of very complex side effects, or also involved in managing and seeing the individual as a whole person. So we supportive care really comes and sees your needs physically, emotionally, spiritually, as well as socially. And it's important to involve them very early on within the process so that they can assist people to maintain a good quality of life and sort of mitigate some of these issues that they may be experiencing through treatment.
Thank you very much. You know, Jesse, from the moment I met you a little while ago, I was fascinated by what you do. And I think I said it to you that it's a very unique role that you play within the cancer community. So I think it would be very helpful for you to talk about that role, because I think it's going to inspire people to perhaps consider things they might not have considered, and the role that you would play in terms of integrating with the care team in general.
Thanks. Yeah. So when it comes down to it, we all know that exercise is very good for us, and research comes out every year that shows that the next cancer, colorectal cancer, breast cancer, thyroid cancer, the exercise plays a very important role in helping these individuals maintaining energy, helping them get through the days. It plays a great role in improving cancer treatment tolerance as well. And then the more in shape you are, or the more you maintain, then it can help you return towards a more normal style of life as you go. So incorporating an athletic therapist like myself, or a physiotherapist, or an individual who has knowledge of safe exercise progression for cancer treatments, as early as you can incorporate them into your team, the better. And that individual will be there to help guide your levels of physical activity. They could be there to provide specific exercises depending on where you feel you're weakest. They can provide external motivation. That's always quite helpful when you have someone who is cheerleading you from the outside, and building up your confidence levels so that you can actually participate in more levels of physical activity as time goes on. There's often a delay between being diagnosed with cancer and then starting the treatments themselves. So using that time there to prepare physically for the interventions that you are facing. So even in as little as 2-3 weeks, 4-5 weeks, if you start to improve your levels of physical activity, then you can start off with a higher base, so that when you are going through the treatments and feel your energy reserves are dropping, then you will have built up a little bit of extra in order to help you.
Yeah. I want to bring both Robin and Sheilah into this conversation, because I'm sure there's a lot of folks out there thinking, yes, but Jesse, I can't get out of bed. Yes, I can't eat. You want me to exercise? You know, that it's that reconciliation. So maybe I'd love to hear from Sheilah and from Robin in terms of their experience with, I'll call it the physical movement, and how that perhaps helped you, how you incorporated that into your treatment plan. Robin, why don't we start with you?
Sure. So I had, oh goodness, sorry, there's a delay. Hopefully that's not going to.
Yeah, is that throwing you off?
Nope, I'll just keep talking.
Okay.
As long as it's not bothering anybody. So with the neuropathy I had as well during the treatment, I was able to, hopefully everyone can still hear me.
Yes, we can.
Sorry.
You're doing great.
Sorry. Okay, thank you. Sorry. It was important for me to at least get outside, but even the wind on my skin, and this was in the summertime, was still kind of biting and made me feel numb. But it was important to me to just at least get fresh air. So the first 2 months of my treatment, I was not too bad and was able to do light exercise because I was still pretty close to having surgery, and I was doing yoga. I've always been fairly active, but going into the third and fourth cycle with the accumulation and the fatigue that came, it was I kind of just made myself. I needed to get that fresh air. I actually worked part-time through chemotherapy because you can only do so many jigsaw puzzles. I needed to do something to have that purpose. So at the end of the day, when you're finished working on the computer, you've got to get outside and get that fresh air. So it was really more for me, not so much about the exercise, but getting the air, and then coming back and just knowing that, even just emptying the dishwasher that day is just me getting out of my chair and doing something that gives me that feeling of purpose. So once I finished my treatment in October, November, I actually laid a floor. So like that was my activity. I probably pushed myself a little too much, but I just needed to be active, and it was a mind over matter thing, but I did the best I could. Again, as I said, it wasn't until August of 2022, after my treatment had been finished in October, that I truly felt like I could start to get back to whatever my baseline was before I was diagnosed.
And you were physically active prior to, yes? That probably made a
Yes.
difference. Yeah, which I think reinforces what Jesse had said. Sheilah, what was your experience with physical activity and in terms of either lessening symptoms or helping you cope differently?
I'm actually someone too who's always been physically fit. That's the irony of all of this. Marathon runner at the gym since I was a teenager, and I'm 60 now. So it's always been a regular part of my life. And I agree with Jesse too that going into cancer and chemo and being fit probably did give me an advantage. I know it gave me an advantage with surgery. Surgery was originally supposed to be a laparoscopic surgery, and after pumping 5 holes in me, they weren't able to pull it out that way. So we had to have a big abdominal incision, and that really set me back. And I struggled after that because, again, nobody could tell me when should I start exercising. It's through the abdominal muscle. Every movement I make is painful. Am I going to tear anything? So I went to, of course, Dr. Google, trying to figure out what I could or couldn't do. And if I'd had a resource like Jesse, that would have been extremely helpful. It was a really slow process. It was really discouraging, very discouraging. And then again, like Robin, chemo then was, the second punch to the gut. It's difficult to be motivated when you're so fatigued or you're running to the bathroom. Colon cancer is really special that way. It's all about the poop, so that's your life. It's that's you have to accept that it's a lot of it you don't have control over. And yeah, it's definitely been a struggle. I did sign up to do the Terry Fox run 2 weeks before I started chemo. Well, no, I walked it, but I was still happy that I walked it because I was post-surgery. And again, not knowing, even my oncologist couldn't say for sure what I should or shouldn't do. But since chemo, I'm pretty much getting back to a regular routine of exercise, and I have started running again. I know I'm going to get in trouble for that, but I have started running again, and I'm signed up for the Push for Your Tush run at the end of May. So we'll see how that
Thank you
goes.
so much. Fantastic.
But
That's great.
but it's hugely important. It's more than the physical. For me, it's the mental and emotional strength that I get from moving. And like Robin said, fresh air. You've got to move, 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 move. And then those dark days when you're feeling afraid that cancer is back and you're going to die, you need to get out. You need to change your view. You need to change the record that's spinning in your head. So it's really important.
And I want to come back to that point, but I first want to go to Jesse to comment on really where is it common for roles like yours to be integrated into care teams across this country. Sheilah made the point that I wish I had had somebody like a Jesse to be able to access. So how common are your roles? Where do people find people like you?
Unfortunately, it's not common enough at this point. I find that it's usually word of mouth on how people find me. So as my client base builds, then so too does the word of mouth and people getting a hold of me. I'm very happy to hear that both Sheilah and Robin managed to maintain their level of physical activity or to the extent that they could. And that's really the take-home message for physical activity, is that you do what you can. You know, what you considered to be intense physical activity before and what was light activity before is not the same. When you're going through these treatments, your energy is being used to recover and heal. So even emptying the dishwasher or going up and down the stairs a couple times could be considered physical activity in these instances. But you know, I'm hopeful and that over the coming decades and years that people like me will be incorporated more closely, or at least the information will get out and it'll be easier to find individuals who can help guide your level of physical activity and answer those questions. When do I do strength exercises? When do I start my cardio exercises? What pain is okay? What pain is not okay? So, you know, it's a progress.
And are you able to comment on when one should redo their floors in their house, the way Robin did as well? That was rather
Potentially
extreme,
when the
actually.
mood strikes, it's okay.
I would.
Right. Yeah, thank you so much. I want to bridge back to you, Maria. I have to believe that there's people out there who simply accept what they believe to be a normal part of cancer and chemotherapy, et cetera, et cetera. Where's that line, or is there a line at all between what is acceptable and not acceptable? When is it really important for somebody to, oh, I'm just accepting what I have versus where I need to really deal with this differently? And what is the role of the pharmacy, especially community pharmacists? I know you're in a hospital. Community pharmacy is available every day, all day for folks. Can you just comment on that?
Right. So thanks for bringing that up, because a lot of it depends on individual cultural beliefs, and there's a range of perspectives out there in terms of what is normal and what I'm going to go through chemotherapy, and therefore I'm expected to be vomiting every day. And a lot of people will come to me and tell me, like, well, isn't that normal? I mean, I vomited 5 times yesterday. Isn't that normal? No, no. So our goal is, I mean, it's not going to be smooth sailing, and you heard it directly from our patient's mouth, but we don't want you to stumble through treatment and not be able to tolerate it. So we're there to help. Um, in terms of a line, well, the lifeline is, getting in touch with your oncology site nurse if you have one, and also with the pharmacist, and reporting when you have a symptom or a side effect, whether or not it's something that was told to you. So, I mean, there's a million possible side effects of chemotherapy. We usually tell you the top 3 or 4 common ones. But if you're noticing something is not right with your body, you should report it. It could be from one of your other medications, it could be from the chemotherapy, it could be unrelated to medication, and it could be even due to one of the supportive care medications that we give you that is, intended to prevent a certain side effect. So it is important to have that conversation with the pharmacist. We want to talk to you to sort of find out, what symptom you're experiencing, where it might be coming from, and work with you to try and make it better. I think I spoke to this before, but we never really want a side effect to be taking over your life or impairing your quality of life. So when it's interfering with your daily activities, then it's an issue, but don't wait until it gets to that point to say something.
Yeah, no, I think that's a very important point to reinforce, because lots of people simply accept it, when I think that there's a community of resources where I think that there's a list of solutions, so to speak, where people can really help themselves. I wanted to spend the last few minutes we have together on a topic that I think we all think is very important, but perhaps isn't discussed enough. And I'm going to put it under the area of spirituality, or mindfulness. So Robin, you've had experience with CBT therapy, and I think our audience would benefit from hearing about your experiences there, how that helped you with your treatments, etc. And then, Carine, I'd love if you would weigh in on the concept, the idea of a more spiritual view of your cancer as well, and how one might go about doing that. So Robin, first let's go to you and your experience with CBT and how it helped you.
Sure. I'm no stranger to CBT, and I actually asked for a social worker after I finished my treatment. I didn't need a social worker during my treatment, but after the treatment, when I guess I thought miraculously I would feel better and not have any issues, then I needed that support. And the social worker through my cancer center was amazing, and she's actually who connected me with a Queen's University behavioral study. And so I did a cognitive behavioral study with them, and that helped. It was very, very focused on mindfulness and not going. You can go to the dark places, but trying to talk yourself back from that ledge and really, really rationalize with yourself the realities of what's actually happening versus the fears of what could be happening, the evidence. And also that social worker connected me with Wellspring, but also with Colorectal Cancer Canada. So those connections have been far more helpful than any support that I did or didn't receive during my treatment. It was during COVID. I had to kind of do it all alone. I was sometimes afraid to ask questions because if I asked the wrong question, I felt a little scolded. If I didn't ask the right question, I felt a little scolded, depended on the situation. So I was very nervous about reaching out and self-advocating. So the connections with the support groups and with that cognitive behavioral therapy and with just really, really connecting. I am a thinker, can't turn that off. It makes me who I am. But adding a cancer diagnosis on top of that just has a little bit more of a level of challenge there. So having those connections has really been amazing, and I think it kind of has given me the idea of what I can do with this to make it a positive thing for helping other people, maybe volunteering. I wrote down push for the tush run. I don't know what that is, but I'm going to look it up and see if there's something I can do with it. So yeah, it's been a great experience.
Well, perhaps you and Sheilah can do the run together because we're all going to be there. Sheilah, I would love to give you the opportunity to comment as well, just on what I call the more mind spiritual side of things, and what you did to propel yourself.
Definitely. I would call myself a control freak. So what cancer teaches you is you no longer have control, and to find a way to accept that. So what I started doing from the day I was diagnosed was journaling. And I made myself, it sounds a little bizarre, a cancer binder. And everything that happened to me is in this binder, and it's something I can refer to. And actually, prior to this call, I was going through my journal, my diary, and everything from side effects, every piece of food I ate, how I felt, if I was feeling dark, what I would do about it is in that journal. And that gave me a sense of control. I don't know if that sounds a little crazy. It felt productive. It felt something that was positive, and I do like to go back and think, look how far I've come since May 31st last year, from the day of diagnosis. I'm not a religious person. I've also become more spiritual that I meditate every day for 5 minutes. I burn sage. Whatever works, do it. You know, it's not something I would have done before, but I'm welcome always to suggestions from my friends and other people who are patients and going through the same process. So it's made me more open to things that might work for me that I never would have thought of before, and felt like I have, or feel now I have a little bit more control over my life.
Thank you for sharing that so openly and honestly as well. Carine, I want to give you the final word. We've only got a couple of moments left before we go to a Q&A, but I just wanted to give you the final comments on particularly, you know, in where you sit within colorectal cancer and the community in general is, all of these resources, both psychologically as well as physiologically, are available to people. Where's the starting place? Somebody feels overwhelmed. What's the best thing they can do?
So the best thing is utilize, as Maria sort of indicated at the beginning of our discussion, is utilizing that team that you have around you. So talking to individuals within your care team about the issues that you may be experiencing, would it be physical, would it be spiritual, would it be emotional as well. Outside of that, however, there are other organizations that are available that can allow you to have access to that support. Organizations like Colorectal Cancer Canada that come and sort of bridge those gaps that people might be experiencing as well. Sheilah and Robin, I'm so thankful that you shared sort of those tricks that you've learned along the way, because you've brought up some great tools that are every individual should have in their toolkit going through following a diagnosis with cancer, which is that meditation, the journaling, utilizing the support groups, reaching out to external therapists if you need, reaching out for that help and that support that is available, and utilizing every tool that you have at your availability to make things, I will not use the word easier, but more manageable. And also sharing experiences from different patients, different individuals, hearing others share their story also can help also normalize what you're feeling as well, and can also provide additional tools and things that you may not have thought of that will be really that could be a benefit to you as well. Sheilah brought it talked about it just a few moments before. Sometimes things that you didn't think that would be useful previously are now some things that you do and you find great benefits. So thinking outside of that box sometimes helps as well.
Thank you so much. And that is, again, the end of our formal part of this session. We're going to bridge to a Q&A period where I suspect that there'll be a lot of questions from the audience. So please, whether you would like to chat to either Jesse or Maria as a professional, or just learn more from Sheilah and Robin and Carine, please ask your questions in the chat, and we'll be happy to take them as they come. Welcome back, everyone, to the next portion of this wonderful session. And all of our panelists are here to answer as many questions as we have time for in about 10 minutes. So welcome back to Carine, Jesse, Maria, Sheilah, and Robin. And I'm going to start with the very first question, really focused, I think, much more for Sheilah and Robin, which is, can you offer some of the practical ways that you, in fact, dealt with neuropathy and cold sensitivity as you experienced? Maybe, Robin, we'll go to you first.
Sure, thank you. So I did experience quite a bit of the cold sensitivity, and I would have gloves ready just standing in front of the fridge was difficult, so I would have gloves ready for touching anything. Lukewarm water for taking pills for 4 months, not so fun, but we actually just unplugged our water cooler, so all of the water that came out of that was tepid room temperature water, and just being careful. It was summer, but even going for a walk in the morning in the summertime, you could feel the cool air on your legs and arms. So I would cover up my skin so that I wouldn't feel any of those pinprick sensations when the wind touched my skin.
Yeah, thank you very much. Gloves is a great idea. Sheilah, anything to add to that? Any other tips?
Yeah, actually, I put a magnetic clip on my fridge with a pair of gloves hanging so that I wouldn't forget to put them on before I opened the fridge. And I'm a fan of Post-its, so I put Post-its over every sink to remind myself, let the water warm up first before washing my hands even. And then because my chemo ended in September, my husband always had the heated seats on in the car before I jumped in. And things like that.
What a great husband you have. That's fantastic. You know, simple things make a big difference, don't they? Maria or Jesse, is there any more what I'll call I'll use the word medical, but any other tools or outside of gloves and heated seats that you might recommend?
Yeah, so I'll just add that with the cold sensitivity is quite common. And although there's no medical treatment or pill that you can take to prevent that, a lot of what Sheilah and described in terms of preparing yourself with some of these non-drug measures is our primary strategy. Some other ideas that I've actually got these from my patients, and hearing how they've dealt with it, are not touching anything metal. That would often start an episode. So, for example, anything from, like you mentioned, the fridge, well, even cutlery, basically anything that's metal, don't touch it unless you're wearing gloves or unless you have some sort of protection against your skin. And again, just being prepared for when you're going to be somewhere to have something to cover up and keep you warm because you want to be able to keep comfortable. This is a side effect that's not alarming or, it's not a permanent side effect, but you need to be able to maintain your daily activities of living and make sure that you're comfortable doing so.
Thank you very much for those. Jesse, I'm going to ask you, in fact, this question is directed for you specifically, which is, how does one actually gauge how much exercise is beneficial while not creating too much fatigue? So it's that balance between doing and not doing.
That's a very excellent question. And the short answer is you really have to experiment with the level of physical activity that you attempt every day, in addition to your activities of daily living. So commonly you can just start with 5 minutes of walking, set something that seems quite easy to accomplish. And then once you've accomplished that, then you can build on it based on how you feel over the coming days. So it's really about experimenting with small bouts of exercise and then waiting for your body to react to find out how it has reacted to that exercise, and then using that knowledge to gauge the next progression. So do you increase, do you stay the same? It's also a good idea to keep an exercise journal. So that way you can say, I was feeling tired this day, we had this many activities, and I attempted this much exercise and it didn't go well. So then you can look back at it in the future and make a different decision the next time that one comes around. So it's really about recording the information or how you're feeling on that day, and then experimenting with how much you can do.
Yeah. Is there such thing as exercises one should not do, or again, that's very personal decision? So, for
Well, that's a
example,
really
if
good
you've been
question. I think it's
yeah, so if you've been a long time, say, marathon runner, and you still feel that you can do some of those things, is there any limitations that one should consider?
Well, I think you should set yourself you're at 1% of where you were before, and then give something really easy a shot instead of pretending where you were 4 months ago or 6 months ago or even 1 month ago. So you really have to ease into it, do the super, super simple workout, and then go from there. Because your body is very busy healing from all of the procedures and treatments that you've had. So a lot of your energy is being used up. So it's about resetting your expectations and where you are presently, and then going from there.
Great advice. Maria, I'm going to throw the next question to you for starters, and then go to Robin and Sheilah just to understand what may or may not have worked for them. But this question is about what are the best ways to deal with chronic fatigue? Ever since treatment, says this person, the quality of my sleep has gotten so much worse. I'm sure that's something you hear all the time.
Okay, so I'll speak from sort of the evidence-based strategies, and then perhaps Robin and Sheilah can add in what they've learned over the years since their treatment. So with fatigue, it's a little bit counterintuitive, but if you do not stay active, your fatigue can worsen. So we know that these treatments, they're bringing down some of your red blood cells, your white blood cells, and that contributes to fatigue. And that's a normal part of the cycle. So you can expect that you are going to feel a little bit more tired, and you're going to need more rest. And this is all comes back to resetting your expectations. So if you were an incredibly busy person and you had a full-time job and you have kids and you have activities and other hobbies, that's excellent. And you want to try to maintain what makes you happy, and maintain some of these activities. You may have to take it down a notch or limit, decrease the duration, but my best advice would be to try and get the support you can to be able to try and keep your day semi-active. We know that some physical activity, as we already learned, can help with combating fatigue. Another strategy that's sometimes overlooked is eating. So a lot of people
Mm.
don't feel like eating when they're on treatment, and but unfortunately, that leads to a cycle where you're actually not fueling your body with energy. And although you may not feel the need to eat, sometimes eating can help.
Yeah, fantastic. Thank you for summarizing that, and it's a wonderful build on what Jesse's just shared with us too. Sheilah or Robin, I mean, did you experience sleeplessness? Any thoughts or ideas that you can offer?
Absolutely. I also agree with the eating. Your appetite isn't where it was before, and you're trying to decide what kinds of foods you can eat, but making good choices that are foods that are going to give you the energy you need. And also, I would say the same advice that everyone should heed for a good night's sleep. Walk away from your electronics 2 hours before.
Mm.
Um, Make your mind peaceful, some breathing, some meditating. That also helped me a lot in the beginning too, to try and get through the night. And don't feel guilty if you have to have a nap during the day. That's okay. Be kind to yourself.
That's what
Thank
I
you.
was going to add as well, was just because I couldn't think about what I was going to eat. Just put it in front of me and I'll eat it. I knew I needed to eat, but don't ask me what I want. And my husband was great about that. Fueled my body, got out and exercised whenever I could. And so then when I did feel tired, I just embraced it and let myself be tired and rested when I needed to. And I am an overachiever, so tried to put aside the feelings of guilt from not being able to do what I normally was able to do. And that helped. That helped quite a bit.
Yeah.
And
Thank you
I'll
for
add on
sharing
to
that.
that is also, this is something we talk a lot about during the support groups, is having that experience with other people, sharing what others are also living sort of puts things into perspective. So also joining those groups can be very beneficial.
Yeah, thank you, Carine. I was going to ask if, I'm sure this is something that you hear all the time from through the support groups. We have time for one more question, although it's potentially a larger one. And Maria, I'm going to ask for your thoughts first and foremost. What is known about the potential benefits of THC or CBD for neuropathic pain? And if you feel that that's something that we can't answer in a brief time, we'll happily share that an answer to that with our audience afterwards.
Okay, very timely, interesting question. Also relates to my work in my master's, so I'm happy to discuss this. I won't go
Fantastic.
into we don't really have a full answer for you, unfortunately, today, but I can say that, this is a preliminary thing that's being researched for specifically oxaliplatin-based neuropathy. It's definitely not anywhere in the guidelines or in our standards of practice right now. It's not even currently approved as a medication itself, but there is work being done on this to see how we may be able to neuromodulate some of the receptors. I think it's definitely something that you can stay tuned and listen and ask your oncologist and your pharmacist about to see where the research is headed. Um, so it's not really something that's incorporated at this time, but it's something that's being researched, and hopefully we'll learn more about how it can be used and the safety of it as well.
Thank you. That sounds like a great session that we could do for at next year's conference, and we'll welcome you back for that. So that's we're at time now. So I wanted to thank Carine, Jesse, Maria, Sheilah, and Robin for coming back and for sharing their perspectives in a wonderful session today.